Assalamu alaikum wa rahmatullahi wa barakatuh. I hope you're having a wonderful start to your day. Thank you so much for choosing Horizon TV this beautiful Friday morning, and welcome to another exciting episode of the Muslim Insight Show. My name is Zamzam Ahmed and my sign language interpreter is Ilhan Noor. With Ramadan expected to start soon as maybe tomorrow inshallah or the day after tomorrow, millions of Muslims around the world will be observing fasting from dusk till dawn. But for individuals with diabetes, fasting can present a unique challenge. So today we are diving into this important discussion about diabetes and fasting during this time, a topic that combines both faith and health as well. We know that fasting is a compulsory, is a mandatory act to us Muslims during this time, or rather during the month of Ramadan. But for individuals with diabetes, managing blood sugar levels and staying healthy requires an extra care, requires an extra attention. So, how can you fast safely while managing diabetes? What steps should be taken to maintain balance during this holy month? To help us navigate these questions, we have a special guest today, Dr. Sairabanu Sokwala, who is a consultant physician and endocrinologist who will share expert advice on how people with diabetes can observe fasting safely and effectively. Assalamu alaikum wa rahmatullahi wa barakatuh, Daktari.
Alaikum salam wa rahmatullahi wa barakatuh.
How are you doing this morning?
Alhamdulillah, good.
MashaAllah, it's really an honor having you here with us today at Horizon TV. Welcome again. So we are talking about diabetes and fasting. Before we even go deep to what is there in diabetes, what is there in fasting while being on this sickness, in simple terms, maybe you can explain to us what diabetes is, what causes diabetes, and the different types of diabetes. Karibu sana daktari.
Yeah, so diabetes is a common condition across the globe, currently affecting more than 600 million people across the world, right?
Okay.
And it's a condition where you have got high blood glucose levels, and that is caused by either a problem with the production of something known as insulin, or when the body cannot use the insulin. So what is insulin? Is just, it's like a key that is produced by a factory in our body known as the pancreas.
Yeah.
So this key actually goes when we take food. The sugar in the food is converted into glucose, and that glucose is actually goes to that factory and gives a signal for this key to be produced, which is insulin. So the key and the sugar, then they go in the blood to the different parts of the body, and where there is the energy giving or the energy forming parts of the body, like the fat cells or the muscle cells or even the liver, then the key opens the door and the sugar goes in and you get energy. That's why the carbohydrates are called energy giving foods, right? So that's how they actually are supposed to give you energy. So what happens is, if the factory shuts down and it cannot produce insulin, or if the insulin is there but it cannot open the door for the sugar to go in, then that means that the sugar is not going to be used and you get high sugar in the blood. And that's literally, in very simple terms, what is diabetes. So if your factory shuts down and it cannot produce insulin, then that is known as type 1 diabetes.
Okay.
And usually happens in children or younger people. And it affects about 5% of people living with diabetes across the world. So it's the kind of the less common type of diabetes, but the prevalence of that even is increasing gradually. And then you have the most common type, which is type 2 diabetes, which what happens is that initially the problem is with the use of insulin, where because of excessive weight or not having enough physical activity, or smoking is also a risk factor, having high cholesterol, high blood pressures, not exercising adequately, a lot of sedentary lifestyle causes you not to be able to use that insulin. So it's like the keyhole is blocked for the key to go in. So what will happen is the sugar is still moving in the blood, so it keeps going and giving a signal to the factory to produce more and more insulin. So what happens is eventually that goes into a kind of fatigue, let's say, when the insulin production goes down. So this combination of having resistance and reduced production causes then type 2 diabetes. It's common in families, so there's a strong family history. and usually, like I said, associated with excessive weight and poor physical activity, poor diets.
Okay.
Yeah, so those are the two main types of diabetes. Then you've got the gestational diabetes, which means diabetes which occurs in pregnancy and due to pregnancy, like the hormones related to pregnancy.
Okay.
And then you've got other specific types also. And this is important when we are discussing diabetes and Ramadan and who should or should not fast, because with the different types, the risk is different.
Okay, and what you've talked about the causes while you are explaining the different types of diabetes, about not doing enough exercise, maybe obesity, and maybe something else. So, how does it relate to Ramadan, to fasting?
Yeah, so it's actually, I'm very grateful to be called on this show today to tell you the truth. I have usually got a very busy clinic and all, but this topic is so important for our Muslim brothers and sisters to understand that diabetes and Ramadan is not one shoe fits all. It's not that. It's not a clear cut to say that, oh, you should not fast, or you should fast, right? So we have to do something known as risk stratification. So just to understand some of the risks that could be associated with diabetes and Ramadan fasting, understanding the types of diabetes. One of them is, of course, the aspect of your sugar possibly going very low, which is known as hypoglycemia, or your sugar going very high, because during the feasting or during the eating periods, if you are not cautious, then the sugars can actually go very high. Or if you skip your medication in fear of a low, you can actually make your sugars go very high, right? So high sugars. The third thing, and these high sugars go to the third big complication that can happen, especially in patients with type 1 diabetes who are not producing any insulin, and that is called diabetic ketoacidosis, which could actually be life-threatening. And then the other complication could be dehydration. So especially nowadays, there are some other drugs also, some medicines that are used for diabetes that can cause sugar to come out in the urine. That can increase your risk slightly of getting dehydrated. Okay, again, high sugars can also increase the risk of dehydration. And the fourth risk, which again can be serious, is clot formation, especially associated now again with the dehydration aspect. So like studies have shown that you can get clots in the eye forming if you are not cautious and you don't do this risk stratification. So the risks are there, but the risks are not universal. That means someone who has got type 1 diabetes does not have the same risk as someone who is has pre-diabetes or type 2 diabetes. So the risks are different. So basically then what we do, or what is recommended, is to do this whole aspect of risk stratification before Ramadan. Ideally this should be done like about 6 to 8 weeks before Ramadan to assess what is your risk. Are you the right person who can fast, or are you the person who should not fast?
Meaning 6 weeks, that is like
about 2 months.
About 2 months.
Yes,
are we late?
We are a bit late, but it's never too late. So maybe just to take a bit on the risk stratification and to decide then who to fast or who not. So when there's actually a wonderful risk calculator now that we have as doctors, as healthcare providers, and it's available online. So when a patient comes to me, the first thing I'll do is take you through this risk calculator, because everybody wants to fast, right? But in Islam, subhanallah, the religion is so beautiful that it gives you exemptions to fasting. Yes, fasting is highly recommended, like you said, but we also have exemptions to fasting, and one of the big exemptions is sickness, right? And amongst that sickness, then diabetes as a chronic illness needs to be considered. So, but patients with diabetes, so we look at certain factors like the type of diabetes, as I mentioned, like people with type 1 diabetes are at higher risk compared to those with type 2 diabetes. Then the duration of diabetes. Someone who has had diabetes for, let's say, 1 year or 3 months, 4 months, has a much lower risk compared to someone who has lived with diabetes for 20 years or 10 years, right? So you look at the duration of diabetes, and these are components of that calculator. Do you have any complications related to diabetes? Do you have kidney disease? Do you have heart disease? So again, that's included. Have you had an admission in the last 3 months because of what I talked about, diabetic ketoacidosis, or there's another complication with type 2 usually, which is known as HHS, hyperosmolar hyperglycemic state. It's again a serious complication requiring admission to critical care units. Or if you have had a hypoglycemia, low sugar, which has required you to be admitted to the hospital. So that's another acute complication. So we look at that. Then we look at the duration of fasting. So like let's say in certain parts of the world, they have seasons. So the fasting can be longer than 16 hours, right? So that's also part of that calculation to say if you're fasting longer than 16 hours, you have a higher risk. Pregnancy now has been excluded in the sense that if you're pregnant and you have diabetes, you are not recommended to fast. You're already under very high risk category. So that's a very high risk for women to fast if they are pregnant and they have diabetes. Another thing to consider is the frailty. For example, older people. If you are frail, you can't take care of yourself, the thought process is impaired, then that's a high risk category also. So when we put all these factors and the type of work also, for example, me sitting in my office would obviously the whole day, most of my day spent sitting or seeing patients talking, has a much lower risk compared to someone who is in construction work or a laborer. So the type of physical labor also is included. So it's a really nice tool actually to help us to assess who can or cannot. Now when we put all these factors into that calculator, then it tells you whether a patient is at low risk, moderate risk or high risk. Now these agreements on whether to fast or not to fast have come up in liaison with the muftis across the major Muslim countries like Egypt, UAE, across the world, and they came together and this created that consensus. So by the time I'm telling you that you are in low risk, which is color green, it actually shows up on that calculator as green, then you should fast actually. And that's a low risk category. That's people who we recommend to fast, unless there are other reasons for which they cannot fast, like the type of work they are doing, or during their fasting they start seeing low sugars. So if there are other aspects which stop them from fasting, then the doctor can advise. But those are actually recommended to fast. Then there's the moderate risk category. So there's a scoring of that between like 3 to 6. So that's patients who can fast, but under very strict monitoring of their sugars and strict follow-up with the doctor. But even in those, if the doctor decides, no, you cannot, your risk is more than the benefits, then even those patients should not ideally fast. And then the high risk is more harm than benefit. So those are the patients who definitely should not, they must not fast actually. And if they fast, then that's a risk to them. And again, Islam does not recommend that we harm ourselves. So that's
talking about high risk and low risk and everything about the risk. Let me take you back a bit. Maybe what are the impact of fasting to a diabetic person?
The benefits. So we talked about the risks, right?
Yeah, we talked about the risk. With the low, somebody who is at a low risk when fasting.
Maybe the risks associated with fasting. I think that's what you're saying. The impact on the patient with diabetes. So the effects are things like low sugar, high sugar, DKA, diabetic ketoacidosis or thrombosis, dehydration. But there are also benefits, if that's what you are asking. So the benefits to fasting, there are a lot of benefits to fasting. That's why patients with diabetes, sometimes we even send them to dietitians who recommend intermittent fasting. And Ramadan is one of beautiful ways of intermittent fasting, whereby you are staying away from food for a certain number of hours. So there are benefits, and that's why, we don't say that no, you should, if you have diabetes, it's not that you should not fast at all. So the benefits could be related to their weight management, if they do it correctly, if they eat their food correctly, and if they stay hydrated, then there is benefits to weight management. There's benefits to sugar control. Studies have shown if it is done correctly in a controlled manner and monitored properly, then it can have immense benefit on improving the sugar control of these patients. Cholesterol control. Some studies have shown benefit to cholesterol control, blood pressure control, control as well. So there are all these physical benefits. One thing I must tell you is when our body is fasted, there is a process called autophagy.
Okay, autophagy.
Auto means self and phagy is eating kind of. So it's like a process where your body refreshes, kind of goes in a, rejuvenates itself. So even the pancreas, it's like it goes through a process of rejuvenation during that period when you've let it not have that food. So it's fasting is a beneficial process, but when done correctly.
So while you're fasting, you should monitor yourself during this time.
Yes.
Okay. We've talked about the type 1 and the type 2, and you've mentioned that type 1 is somebody who is type 1 diabetes is at a high risk of fasting, right? And
higher risk.
At a higher risk. Probably you could tell us about the difference in type 1 and type 2. Any specific guidelines? Are there any specific guidelines, especially for those who has type 2 diabetes?
So with related to fasting, right?
Yeah.
So basically when you look at type 1, again, previously we used to say, no, if you have type 1 finished, that's the end of the story, you're not going to fast.
Okay.
But now we know studies are showing that even patients with type 1 can fast as long as you put them through that risk calculator that I talked about. And if they fall at low risk, if their score is they only have type 2 but it is well controlled, they don't have hypoglycemia, they can monitor their sugars, they are fasting for less than 16 hours, they are young people, recently diagnosed. So if you have all those risk categories put in and you see that the risk comes as low risk, then they can fast actually. But the way to fast is a bit different compared to someone who has type 2, and this depends on the medication also that they are using. So the medicine recommended for type 1 is insulin, right? It's the injection of insulin because, like I said, the body is not producing insulin. So insulin is usually given in the form of injections. At least here in our part of the world, we only have the injectable insulin, right? So it's either the injections or there is something known as the insulin pump, which delivers continuous insulin into the blood. Okay. So that's like attached to the patient's body, and it's connected to something known as a continuous glucose monitor in most cases. And then it tells you, it delivers insulin continuously into the blood, right, at a small amount, and then during meals there's a certain amount that is added. Now what happens is, for type 1 then, if you are on an insulin regimen, which is like you're taking one long-acting insulin. So in our body there is insulin produced in two ways. One is the same insulin, but there is some insulin that's produced continuously, whether we eat or not, if you don't have diabetes. And then there is the insulin that's produced when you eat food, so you get these spikes during your food, to use that food like I explained. Now, that's the way we give insulin to people with diabetes type 1, whereby we give one long-acting insulin once a day, and then we give these short-acting insulins during the meals or before the meals. That's the most recommended way of giving it, other than the pump. But this type now, depending on where you are, you could require even 5 injections in a day. So that this means there are 4 injections, right, before the meals and one long-acting. However, depending on the type of insulin, you might be required to inject even 5 times in a day. So these patients, then what we tell them is the long-acting insulin they'll continue to take. They'll take it at night. And then the short-acting insulins before the meals, they will only take before the meals that they eat. So they'll eat iftar and they'll eat suhoor, right? So they'll take before iftar and they'll take before suhoor. And they miss the lunchtime dose because, of course, they're not eating lunch. Now, if you look at the type 2 diabetes, so that is mainly the adjustments to insulin that we do. We adjust the doses as well, whereby we reduce the suhoor dose a bit compared to the iftar dose, and that should be done by a diabetologist, a specialist in diabetes, preferably for type 1, who is planning to fast. So my advice to the viewers is, if you have type 1 diabetes and you want to fast or you are willing to fast, please make sure this is done with consent or with guidance from a diabetes specialist. Especially for type 1, For type 2, at least a physician should be able to review before the fasting month starts so that they are guided on the treatment. Now, even type 2, there are some patients with type 2 who are on insulin, same way like type 1. So those also are high-risk individuals usually. Oh, sorry, I forgot to mention in the risk category, risk stratification also, the type of medicine you are on is added in the risk. So those who are on insulin are at higher risk.
Okay.
So that's why if a patient with type 2 is on insulin and requiring multiple insulin injections, they fall under the high risk category most of the times, right? And so them also, if they are fasting, moderate or high risk, if they are intending to fast, then they need to get this adjustment of the doses done. So that's very important to be done even before Ramadan. So yes, inshallah, tomorrow or day after we're expecting to have Ramadan. If you have not yet seen your doctor, please make sure you see them, because it's not that you are supposed to stop your medicines. There's adjustments to be done to these medicines to allow you to fast safely in Ramadan.
Okay, you've talked about the complications that are there while fasting, the hypoglycemia, the hyperglycemia, diabetes, ketoacidosis, and maybe how can someone who has diabetes avoid these complications like the diabetic ketoacidosis while fasting?
Yes, excellent question. That's a really wonderful question. So, like you said rightly, the risks when we fast are there, and you have diabetes. And if you fall under the low or moderate risk as well, I mean, under high risk, we have said you should ideally not fast, right? But there are some patients who will still insist that they want to fast. Definitely. Remember, you're harming. In that case, you could, not you are, but you could create more harm than benefit. So you have to be very careful with it. But if you do, still proceed with fasting, whichever category you are in, the most important thing to understand is, first is understanding your risk category. Number one. Number two is to monitor your sugars. So in case you are fasting, and you have diabetes, then you need to monitor your sugars. So monitoring of sugars depends again on the risk category you are in and the medicines you are taking. So someone who has type 1 diabetes needs to monitor at least 6 to 7 times in a day. And the times of the day that are most appropriate to monitor then would be like before iftar. Before iftar is considered your fasting sugar, right? So just before iftar, 2 hours after iftar, before suhoor, 2 hours after suhoor, at around, ideally recommended to be done at midday, that's around 12 o'clock, and 4 p.m. Now the sugar that's like the most important is that 4 p.m. sugar, midday and 4 p.m. Because that could guide you in which direction you're going in your fast, right? And that's when most of the times the low sugars happen. So if your sugars, if you have checked your, or any time that you're feeling unwell, you need to check your sugars. Okay. Now if your sugars are less than 4 millimoles per liter, or in milligram per deciliter, that's less than 70, then you are supposed to immediately break your fast. And you have to be ready to do that before you even start fasting. And even if it is 1 hour to the breaking of the fast, even if it's 1 hour to iftar, it is not a test of your strength, right? Or your iman. It's not a test of your iman that, okay, I will pull through. Avoid doing that with diabetes, So even if it's just 1 hour, even if it's just 30 minutes and you see that your sugar is low, you need to break the fast. Okay. Yeah, that's recommended religiously as well, right? Yeah. So that's like how to take care of low and high sugar. So if your sugar is more than 16, you also should break your fast immediately. If your sugar is between 4 and 5 any time that you monitor during the fasting hours, then you need to repeat it within an hour. If it is going below 4, then you need to break your fast. If it remains 4 to 5, you can actually carry on, check again after 1 or 2 hours, and just make sure that it is not going below 4. If you get symptoms, you need to break the fast immediately. And you need to then recognize the symptoms of a low sugar and a high sugar, right? Okay. So what would be these symptoms that you could experience? So if you have a low sugar, you could feel excessively hungry. You feel your heart is beating very fast. You could start sweating. Sometimes you even feel dizzy. And some patients in the worst case scenarios could lose consciousness. Okay. So preferably the family should also know these symptoms so that you recognize them as they are setting in and not let them go to the level of unconsciousness. So some people with diabetes may not even go through all these stages and they directly go into unconsciousness. So that has to be very careful done. And that's why the monitoring is very important to prevent you to get these complications. Yeah, so and the symptoms of a high sugar would be, they are not very specific. Unfortunately, the high sugar symptoms may not even appear too strongly, right?
Okay.
But what you could expect is excessive passing of urine, feeling excessively thirsty, feeling fatigued. You feel tired because your body is not using the sugar to give you energy. So you feel tired, you could have blurry vision sometimes.
Okay.
So those are the symptoms to tell you that now your sugars are probably going high, and you should check immediately while you're starting to experience those symptoms. Yeah.
Okay. Oh, thank you so much. So those are the symptoms of the high blood pressure and low low blood sugar and high blood sugar. I want us to take a short break, and we will be back with more on this beautiful and important discussion about diabetes and fasting, because it's really important for us to understand the importance of fasting, or maybe the importance of fasting while you have diabetes. It's really important. It's a health issue that is really requires monitoring, inshallah. So we take a short break, and we will be back with more.
Horizon TV, the beacon for the nation. Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والذين إذا أنفقوا لم يسرفوا ولم يقتروا وكان بين ذلك قواما. والذين لا يدعون مع الله إلها آخر ولا يقتلون النفس التي حرم الله إلا بالحق ولا يزنون ومن يفعل ذلك يلقى أثاما.
Pearls of Wisdom.
Abu Sa'id al-Khudri, may Allah be pleased with him, narrated that the Prophet sallallahu alaihi wasallam said, O Allah, I take refuge in you from anxiety and sorrow, weakness and laziness, miserliness and cowardice, the burden of debts, and from being overpowered by men. Quote of the day. Uthman bin Affan radiyallahu anhu said, do not quarrel and do not create differences among yourselves. Hold fast to the rope of Allah and maintain unity in your ranks.
Kilele cha mfungaji ni jamvi la futari, lakini sio futari tu, bali ni futari iliyoandaliwa kwa hamu, ujuzi na mipango ya afya. Ndani ya msimu huu wa Ramadhan, ladha halisi inakuletea mandhari bora yenye kukuza afya yako ya kimwili na kiimani, kutokana na mapishi ama maandalizi kemkemu yenye kujaza rutba na vile vile siha, huku ukipokea mawaidha yanayoambatana na mlo huo kupitia mashekh wetu.
Pata ujuzi wa kipekee naye Rahma Swaleh akikuandalia mbinu kadha wa kadha za futari zetu, huku kituzwa mawaidha ndani ya Horizon TV.
Nikajiuliza maswali, nikajipiga msasa.
Mungu yuko ama hayuko? Ni Mungu gani tunaomba?
Because I just don't want to follow Christianity just because I'm born into it. I want to conduct a research and pick the best one.
Which is original wenye.
Sikutamka shahada, nimekuja kutamka shahada baadaye, baada ya kujulishwa kwamba kumbe unafaa kutamka shahada. Wakati ule tulipewa tu majina.
I go to the masjid and I listen to the khutbah. I love it. When people get up, I do exactly what they're doing. I don't know about shahada, I don't know about wudu, none of that, you know.
Yule bwana kanishika, assalamu alaykum, salam, ushaswali Yasir? Ambia bado sijaswali. Asema sasa hii kitokea umekufa, utaambia nini Allah?
I faked my life as a Muslim girl. Nilikuwa navaa hizo nguo, nikakuwa free, but I'm still doing drugs. I'm still selling weed in my abaya.
Siku moja nikamuuliza, anko, ni kweli hii paka ni jini inaongea na wewe? Akaniambia, anko, hizo ni fitina. Siku moja utajua hii dini na utaipenda na hautaiwacha.
This Ramadan, the stage is set for an epic battle of minds. Join 24 schools with their brightest students and teachers as they face off in the ultimate quiz challenge. With 4 expert judges, fast-paced questions, and the thrill of the game, who will rise to the top? The winner will take home stunning trophies, certificates, and the pride of being crowned the best. Behind the scenes, a dedicated crew ensures every moment is captured perfectly, bringing the excitement straight to you. This Ramadan, it's more than just a quiz. It's a celebration of knowledge, teamwork, and the spirit of competition. Tune in for the Ramadan Quiz Show, where champions are made.
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to another segment of the Muslim Insight. Thank you so much for staying here with us at Horizon TV. We are talking about diabetes and Ramadan. How can a person with diabetes fast during this precious time, or during this time, the month of Ramadan? Before we took a short break, we were talking about the symptoms and the symptoms of low and high blood sugar, and some few of the symptoms are the heartbeat, somebody who is feeling hungry, somebody who's thirsty, fatigue, excess urine, blurry vision, among other. Maybe before we continue, you can just at least tell us, highlight for us these symptoms a bit. I know you've talked about it.
Yeah. So symptoms of low sugar, we said, is primarily feeling excessively hungry, feeling your heart beating very fast, so palpitations, feeling anxiety as well. Sometimes you feel like a sensation of pending doom, you know.
Okay.
Or you could have consciousness impaired, so confusion. Some patients, they have confusion when they, especially if the sugars are going towards the very low levels, then you could even have confusion or altered mental state. And in the worst case scenario, even loss of consciousness. So these are the symptoms of low blood sugar. When you look at the symptoms of high blood sugar, then you could have excessive urination, excessive thirst. You could even have excessive hunger in the high sugars as well. If the sugar is too low and you don't have enough, too high and you don't have enough energy, you could have blurriness of the vision. You could have excessive fatigue, like you just feel excessively tired. So those are some of the symptoms now of the high blood sugar. Again, if the blood sugar goes very high and causes symptoms leading towards, when the sugar is too high and your body doesn't have enough insulin, then your fat breakdown happens, and that releases products which are acidic, so they increase the acid levels in the blood. Okay. And that's what is called as diabetic ketoacidosis. So you could get now confusion as well coming in that kind of a situation. You could get pain in the tummy because of the DKA. You could get fast breathing. So those are now the symptoms of the extreme of high blood sugars.
And that's the reason for people with diabetes should consider monitoring themselves. Yes. And with that monitoring, how often should people with diabetes monitor their blood sugar levels while or maybe during the fasting hours?
Yeah, a good question. So we discussed about how frequently a person who has type 1 diabetes and is on multiple insulin injections should monitor. Okay. So that's the highest risk, right? Or the high risk individuals. So there are some patients even with type 2 diabetes who could be on the same kind of insulin regimen where they've got multiple insulin injections, or they are on medicines which can have a chance of lowering your blood sugar, like they are called sulfonylureas, things like gliclazide, limepiride, libenclamide, especially gliclazide and limepiride have like the I can't name brands, but basically those are the ones that have the lower risk of lowering the sugars compared to other products in this same group, like the glibenclamide, like no glucose stuff. They have a higher risk of taking the sugars very low. So basically then those group of patients who are at a high risk of low sugars should basically be monitoring more frequently. So when we talk of more frequently, they are, like I said, 7-point. It's known as the 7-point glucose monitoring in the month of Ramadan. And what is recommended is before breaking the fast, so before iftar, that is the fasting sugar, and then 2 hours after iftar from the time of the starting of the break of the fast, right? Okay. And then a sugar before suhoor, a sugar 2 hours after suhoor, midday, 4 p.m. So those are 6, and then 1 if you are feeling unwell at any time, then whether like the symptoms I talked about, or even if you start having a fever, any symptoms, diarrhea, anything. If you are feeling unwell, you should check your sugar immediately. Okay. However, what we realize is that people cannot always afford all these 6 times readings, right? So we have to be very specific about if someone can just afford or be able to do only 2 readings or 3 readings in a day, then how to go about it. So before even going to that, there are some patients with diabetes who don't require that much frequent monitoring, like the low risk individuals who are on lifestyle modification only and they are not on any tablets for diabetes. There are some people who we don't put on treatment with medicines, and they only do diet and exercise and control their sugars. So they don't need to monitor the sugar 7 times a day. They could even, in the beginning of the Ramadan days, like 3 days, they could check about 4 or 5 times. But if they see all their sugars are okay, they can actually check 2 or 3 times. Okay. Whereas there are some who may require a little bit more frequent depending on the type of medicine they are on. So ideally the doctor should tell you how frequently you need to monitor your sugars. Now, if you cannot afford, if you just cannot afford or you cannot access the glucometers or the strips to check sugars, because we understand we are not in the developed part of the world and we have our constraints. So which are the most important readings you must do? Okay, so one is the most important in the day, I feel, is the 4 p.m. reading, because that will guide you towards the direction you are going in. So if you have symptoms, then that is the most important. That's the one you should do immediately. But if you don't have symptoms, then at least the 4 p.m. and the before iftar reading, and at least 2 hours after iftar. If you can't do anything else, at least those will guide you on how you are doing. So one day you can do that. The other day you can actually do before suhoor and 2 hours after suhoor. Okay, or just even a before suhoor and a midday. So you decide. Sometimes what we do is I've given you like the 6 to 7 readings that you can do. Now you choose, like you'll do 3 readings one day and 3 readings the other day. Or if you can't do even 3, then you choose 2, 2, 2 on the 3 different days. You see, so at least in a week it will tell you, okay, this is the way my sugars are behaving, and this is where I need to increase or reduce your medicines or your diet adjustments based on the way the sugars are then behaving. And like I said, that should be done in liaison with the doctor beginning of Ramadan. If you have not done so even now, yeah, to be able to be advised on how to change your drugs during that time.
Okay. Talking
so
about...
while at that, I'll just like to tell our viewers that over the last 3 years, myself and a few colleagues, including now the Kenya Association of Muslim Medical Practitioners and a few colleagues from the Aga Khan University Hospital and a Comprehensive Diabetes Center, we have come up as a group, and we have been distributing free glucometers and strips to our brothers and sisters living with diabetes who are on complicated regimens like on insulins or on drugs that can reduce the sugars, or we've been giving them, and who cannot afford to get the glucometers, so we have been providing them free of cost across the country. So if you still haven't received yours, or you are facing a challenge and you need to monitor your sugars, you can reach out to your healthcare providers who can then guide you on how to get through to us to be able to help with the glucometers.
Okay, something else is, according to my understanding, all these requires diet, right? Maybe you can tell us about the types of food a person with diabetes can be taking.
Yes, again another excellent question, and that's where the biggest discussions are around, because you know in Ramadan we think it's more a time of feasting rather than fasting. So that's when all our cooking skills come out, you know, all our foods that are, you know, those fried stuff, all the varieties, you'll see it all over the social media everywhere, how to make the best pecked potatoes and you know, bhajias and you know, mandazis, a lot of all this fried stuff. We actually reserve it only for Ramadan. High carb content, carbohydrate meals like potato containing meals and starches and all that. The desserts are the ones which show up the most during Ramadan. Sweets and juices and all that is quite well displayed on our tables. So it's a very interesting discussion to have, and it can take like at least 1 hour just discussing food, but I'll just stick to some few concepts of diet that need to be taken care of, right? So number 1 is the portions, right? So we don't say just don't eat any carbohydrates. Of course, that's not recommended at all. So what I can say is during your iftar time and your suhoor time. So your suhoor can have a higher component of carbohydrate compared to your iftar. Okay, because suhoor you are going to fast the whole day compared to iftar. So if I talk of balancing a plate, you have to still make it palatable. I can't tell you that, you know, you break your fast with sukuma wiki, for example. It's not the thing that you're looking forward to the moment you break your fast, and that can be kind of a put off for many. So we recommend, like if you're balancing your plate, a simple plate to tell you for iftar, a very simple plate is protein to be included. Protein can be plant protein or animal protein. If half of your amount you can include it as a protein, which means that you're looking at things like either meats, chicken, fish, anything containing any kind of preparation of those foods, or plant proteins like green peas, soya beans, lentils, okay, for the vegetarian brothers and sisters, or if you opt to do vegetarian, then that's the protein. So you must have protein in your meal, okay? Then try to have, you know, a smaller portion of carbohydrate. We're looking at iftar. So yes, if you have that one potato that you must have, okay, remember you'll even break your fast with a date. So date we don't recommend more than 1 for people living with diabetes, okay? So you can break your fast with 1 date. Okay, although we know like sunnah is to break with 1 or 3 or 5. So why do 3 when you can do 1? So do break your fast with the date. Remember that has high sugar as well. So after you've broken your fast with the date, you can have one fried food if you must, one piece. If you can avoid that, then that's even better. That you'll be doing, when you're doing your carb, you're doing like a high fiber carb, things like wheat or barley or rye, you know, flour if you're having. If it's rice, then preferably brown rice or a small portion if you must of the white rice. We avoid that a bit because it can spike your sugars. And then you include a vegetable.
Okay.
So vegetable could be your greens that we talked about, but it could also be, you know, any kind of, like broccoli is a vegetable. You could have asparagus, broccoli, you know, things like, you could make it with a bit of coconut milk if you want. You know, you can modify it and have that green with your meal. So if you have other options and the green, you'll feel like, okay, fine, it's okay, you have other options. Okay? And then salads. So we focus also on a bit, you can make beautiful type of salad. I would really recommend us to be sharing videos and, you know, options of how to make palatable, delicious salads. There are thousands of options available. Chicken salads, and you can make tuna salads, and you can make, name it, you know. A lot of different types of salads that we can venture into and make, right? Carrots, and you can put a few fruits, you can make that salad, but not fruit salad. So we do not recommend combining fruits. You can add a fruit, one fruit. Okay, and the quantity matters. So like not a whole mango, for example. If you have a mango, then a slice of a mango. You know, this whole aspect of fruit salad, then you put custard on top and all.
Yeah.
That shouldn't be for people with diabetes, yeah? So that one, you need to choose that one fruit. What we say is the fruits with the lowest spike in sugars is things like the berries, like blueberries, raspberries, okay, even strawberries. If you can afford that or you can get that, well and good. If you can't, then apples are also good. You could have even half an apple or even a whole apple. But then you have to then take care of not including other carbs. Okay?
Yeah.
Another type of fruit is pears, which are not very common in Kenya. But the common fruits that we get have quite a bit of sugar. So you have to be careful with the quantity that you take. Okay? Then if you look at suhoor, now at suhoor as well, your plate could be kind of similar. You could increase a bit on your carbohydrate portion based on the way your sugar control is. And then of course you'll monitor and you'll see after 2 hours, if you see, oh God, this suhoor, it really spiked my sugar. So then the next day you'll take care of reducing that sugar component of it. We discourage use of fruits juices. Okay, so sweetened drinks. The drinks that are recommended is things like water, milk. You could have coffee or tea, but not at suhoor preferably, or low amount at suhoor. You do it at iftar time. Caffeinated drinks are discouraged because with diabetes they can increase your risk of dehydration. And then of course sweetened beverages we just do not recommend. Milk, 1 glass could be okay. Again, you will check your sugar levels after that, but not milkshakes.
Okay.
For example, right? And if you're doing a smoothie, it could also just have, you know, avoid the fruits that can increase or spike your sugars if you are doing a smoothie and you must. But preferably avoid sweetened drinks and fruit juices, smoothies altogether.
Okay, we are talking about the carbohydrate, the proteins, the different types of food, the drinks and everything. Let me ask something else about the spices that are being used to cook. Is it a risk to the people with diabetes?
Which spices in particular?
We have the spices that are being used to cook. We have cardamom, cinnamon, and everything.
So those are good actually. Studies are showing benefits of, for example, there are studies looking at benefits of ginger, benefits of cinnamon in people with diabetes, and they do. So imagine it's a wonderful way of sweetening even something that you know you really want to eat. For example, you want to have custard, for example, yeah, simple thing like custard. But custard, instead of adding sugar, if you can just add a bit of freshly ground cinnamon, it will give that sweet taste and it will add some taste, flavor to you.
Okay.
So if it's a dessert you were really craving for and you want to have, and that's a better option compared to adding sugar. So even in your tea, for example, if you add cinnamon, is a better option than adding sugar. You understand? Yeah.
Yeah.
So spices, depending on what you're eating, like I wouldn't recommend dried sultanas, for example. They're not spices, but these are condiments that you could add to your meals, right? Those can spike. Those are grapes actually that are dried. So that can increase your sugars if you eat it in large quantities, right? Yeah. So desserts, yes, we do not recommend desserts as such, but you can modify and you can have desserts in a small quantity, as long as you're taking care of your rest of your carbohydrate composition and you're monitoring your sugars to see how the dessert is affecting your sugar levels, but not with added sugar.
Okay.
That's what we have to be very careful about, and the quantity really matters, right?
Okay. We're talking about the symptoms, the ways that a person can, or the different types of food a person with diabetes can take during this time of Ramadan. Maybe the suhoor time, maybe the iftar time. Let's talk about the precautions that this person can take.
During
Ramadan? They say precautions are better than cure. What precautions can a person take?
So we have discussed the food precautions that you can take, and another thing additional is to stay hydrated during the time that you are able to eat. So drink water, right? But you have to check if the patient has heart failure or kidney problems, then you have to be very careful with the water intake. Again, those become high risk patients. So first, if they do fast, then they need to consult with the doctor before understanding how much of water they can take in a day. But otherwise, most of the other patients can recommended to take at least 6-8 glasses during the time that they are able to eat and drink, right? So that's one precaution. Secondly, again, like I said, avoiding foods which are high in glucose levels, high sugar levels, even high fat levels, because that could also affect not only the weight, body weight at the end of Ramadan, but also it can affect your resistance to insulin, and it can also, like some foods, right, with high fats, but in the long run, it can also, cause gastric issues like high acid reflux and stuff like that as well. So we would avoid those, like high fatty foods, especially the unsaturated, the saturated fats, okay? Then you need to monitor your sugars, like we said. You have to monitor your sugars the way we have discussed based on the type of diabetes. And another precaution is when to break your fast, and that also I think we have discussed in detail on when you need to break your fast.
Okay.
So you should have a low threshold to break your fast if you have diabetes.
Okay. Talking about the symptoms, if I may ask, these symptoms that maybe this person with diabetes sees or observes during the day or during fasting, is it okay to say that if these symptoms occur, I should stop fasting? Or maybe
I think we have discussed that in a lot of detail, but if you get these symptoms, you should immediately check your sugars ideally. But if you don't have a glucometer or the access to the machines or the strips, then you need to break your fast. If you have these symptoms, then you really need to break your fast immediately, if you cannot check especially.
Okay. Since time is not on our side, maybe one last question about this. Can fasting cause long-term complications for people with diabetes?
Well, if we look at fasting, is usually that 1 month that you're fasting, right? So it is not very common to get long-term complications after the fasting period. However, if you do get like a severely low sugar during that fasting period, and if it is not corrected quickly, then that can cause even brain damage in the long term, because the brain depends on glucose. So it could cause some permanent issues or long-term issues. So that's why you need to recognize these symptoms. You need to monitor your sugars, because they can have significant effects if they go to the severe level, but that's not very common, honestly speaking, if someone monitors their sugars, okay? But so that's one of the things I can think of long term. But looking at the effect on kidney functions, on heart functions, there are different studies looking at different aspects, and some studies have shown benefits to long-term improvement. But some studies, if the fasting is not done in a controlled manner and high-risk patients end up fasting, then they can increase the risk. Like because of the risk of dehydration, you can actually worsen your kidney functions, and that could potentially have, an impact in the near long term, or probably even in long term to worsen your kidney profile, right? So that's why you have to be very taking precautions. Just one thing I think we didn't touch on is exercise. I think that was something important to bring up.
Okay.
So remember, like for all patients living with diabetes, we talk of the importance of exercise, whether you have type 1 diabetes or type 2 diabetes. Now in Ramadan, of course, what we do recommend is not to be doing vigorous exercise during the fasting hours. Taraweeh, we are blessed to have Taraweeh as part of our like a religious recommendation. If you pray Taraweeh, you are gaining not only the spiritual benefit, but it's a form of exercise. If you do it, you know, while standing and all, depending also on the number of rakahs that you do.
Yeah.
So Taraweeh should be included as part of your exercise. So if in a day normally, out of Ramadan, you exercise for, let's say, 30 minutes or 45 minutes, then Taraweeh, the duration that you have for Taraweeh should be part of that. You can additionally exercise during the night time, like after iftar, preferably, for whichever kind of physical activity that you usually do, you can do it at that time. Preferably to avoid intense physical activity during the daytime. Okay, you could do your moderate activity like walking, you know, not excessively intensively running and all, but you could still do a stroll, you could do your walk during that time, even if it's 10-15 minutes. You could basically climbing up and down the stairs, doing your home, you know, the chores at home. At least being physically active, that's recommended. That's how your weight will improve as well during the Ramadan period.
As we wind up, before we even started the show outside this table, you were talking about the app that a person can use. As we wind up, maybe you can tell us your advice to the people with diabetes while during this precious time of the month of Ramadan and this app.
Yes, so the Diabetes and Ramadan Alliance, Global Alliance, have actually come up with an app which you can easily download from Play Store. It's known as the Dar Safa app. So it's Diabetes and Ramadan Safe Fasting. And this is for anybody. It's not for specifically for healthcare providers. Even a person living with diabetes or you know, a lay person can easily go onto that app. It is in multiple languages, and there are video recordings, there is presentations, there is, you know, information for reading, there's dietary advice, there's exercise on advice on when you should stop fasting, like whatever we have discussed is quite nicely covered in that app. So we recommend every person living with diabetes to download that app if they can and go through it before Ramadan.
Thank you so much, Daktari. That was really a nice conversation, mashallah. Talking about diabetes and iftar, and Ramadan. How can you manage, or how can you fast safely during this precious time? And one thing I understand is you have to monitor your blood sugar level. If you are, I'm not saying that you should not fast, I'm not saying that you should fast, but again, you should know that if you are at a high risk, maybe you should avoid fasting. If you are at a low risk, then you have the chance to do fasting, inshallah. Until next Friday, same place, same time, my name is Zamzam Ahmed. Assalamu alaikum wa rahmatullahi wa barakatuh.